So, hi, I'm Tiffany Fennell, Chair of VA's section of Division 18. I'd like to welcome everyone to today's webinar titled Whole Health and Psychologists Supporting Cultural Transformation, presented by Dr. Kathy Hedrick. This webinar is sponsored by the VA section of APA Division 18, Psychologists and Public Service. Division 18 is considered the home division for VA psychologists in APA, as well as for other public service psychologists like those in state and public hospitals, Indian country, criminal justice, and police and public safety. For more information about Division 18 and the Veterans Affairs section, please check out the Files and Web Links pods for a brochure and links to our website, Twitter, and Facebook page. And you'll also find a copy of today's slides in the Files pod that you can download for reference. All questions can be entered into the chat box, and then we will have time left towards the end to answer any questions. And if you experience any technical difficulties, just let me know in the chat box and I'll attend to you as quickly as possible. And one last word before I introduce our presenter, I want to express my excitement for and acknowledgement of the first annual Psychology Recognition Week in the VA. So the dates this year are April 14th through 20th, and in future years it'll fall during the third week of April, coinciding with the UN's Annual Psychology Day. This is really special, and to quote our National VA Psychology Lead, Dr. Stacy Pollock, the history of VA psychology, or the history of psychology in general, is inextricably intertwined with that of VA, as the creation and growth of VA led to a dramatic increase in the need for psychologists to provide care for World War II veterans. And the VA trains and employs more psychologists than any entity in the United States. And I recently heard that we're approaching nearly 6,000 of us. And VA psychologists provide a range of services to VA and to veterans, serving in clinical, research, educational, and administrative roles. So happy first ever Psychology Recognition Week. And I'm grateful to my colleagues for their passion and dedication to serving veterans. And with that, I'd like to introduce one of those incredible psychologists, our presenter today, Dr. Kathy Hedrick. She's the clinical psychologist and regional field implementation lead for VISNs 19 through 22 in the VA's Office of Patient-Centered Care and Cultural Transformation. She's a graduate of the University of Southern Mississippi and previously served veterans at the W.G. Bill Hefner VA Medical Center in Salisbury, North Carolina, prior to joining the Office of Patient-Centered Care and Cultural Transformation. She has a background in the assessment and treatment of PTSD and forensic psychology. So it's my pleasure now to introduce Dr. Kathy Hedrick.
Thank you so much, Tiffany. I am really excited to be here today. The whole health journey is just such an exciting thing happening for VA at large, and having the chance to talk to my colleagues about this is really a very exciting and meaningful thing for me to be doing. So thank you for having me. To talk a little bit about the objectives of what we hope to accomplish by the end of today, we really want to go over the major components of the whole health system. Make sure, some of you may be well aware of the whole health system. For some of you, this may be new. So wanted to make sure that everyone had a bit of a briefing on what we are talking about with our whole health transformation. And then really discuss the relationship between whole health and complementary and integrated health. And then also discuss the relationship between whole health, clinical care, and the role of psychologists. And there are so many ways that psychologists are already involved in the whole health transformation, and then many more that we can and should be exploring. So as time permits, I also want to review some early outcomes that we're seeing from the whole health transformation across VA. This is going to be pretty heavy on information, so please feel free to contact me after today if you have any questions that we may not get to today if we don't get to them. So this really just kind of shows where healthcare is currently. So when we think about our, as a patient going into our most recent medical or clinical interaction, and then even in these systems in which we're working, we see this in our clinical interactions, in our forms, in our documentation, in the medical record. we're really starting with the deficits. So what's wrong with you? What's the matter? That find it, fix it approach. If we can find out what the problem is, then apply a treatment, then we fix it. And this is what we really call the reductionistic model of healthcare. And what we see here is how our healthcare system timeline of intervention really plays out. And you can see here that there are initiating events well beyond when we see the disease burden really beginning to take off and the cost impact really increasing. However, our typical interventions really are not currently happening until after the disease burden is already on that upward slope. So what we are seeing in all of the financial models, the insurance models, as well as our health outcomes, is that we really have to challenge the assumptions upon which we're building our healthcare systems and really look at re-envisioning and redesigning that healthcare system. And this re-envisioning is not limited to VA. This is something that we are seeing nationally and internationally. You look here at the Institute for Healthcare Improvement. They have new rules for radical redesign in healthcare. And these 4 rules from the list that they come up with particularly highlight the transformation we are embarking on in the VA. So changing the balance of power, really becoming a partner with our patients, our families, and our communities, customizing the care to the individual's needs, values, and preferences, promoting well-being, and then also creating joy in work. And as psychologists, these have been cornerstones of our collective values. So as we go through this today, a lot of this may resonate with you. And honestly, that's really how I got involved in the whole health work going forward, is because it felt so similar to how I had been trained and how I was practicing. And here we have a quote by Atul Gawande. For those of you who aren't familiar with him, he's an American surgeon, a writer, he's a public health researcher, practicing general and endocrine surgery in Boston at the Brigham and Women's Hospital. But he says, we've really been going wrong about what our job is in medicine. We think our job is to ensure health and survival, but really it's larger than that. It's to enable well-being. And well-being is about the reasons one wishes to be alive. And those reasons matter not just at the end of life or when disability comes, but all along the way. And what we're seeing is that the VA healthcare system really is changing. And it's really exciting because it's leading the transformation. So a lot of exciting things happening in VA right now. Our patient-centered care whole health transformation is supporting the larger VHA mission of honoring Americans' veterans by providing exceptional health care that improves their health and well-being. Our mission is not just about the disease, it's really about treating the whole person. And in taking this systems approach and shifting to an earlier timeline of engagement with our veterans and beginning the personalized health planning that includes focusing on engagement, empowerment, and equipping them with skills for self-care, we're really beginning to see this transformation. And this transformation is supported at the highest levels of VA right now. Our current Secretary, Robert Wilkie, has stated VA's whole health approach helps veterans live their lives to the fullest by developing a personal health plan that integrates many areas of their lives. Veterans can truly take charge of their well-being and improve their health all around. We're also seeing this incorporated into our strategic plan. And what's really exciting about this is that despite the many transitions we've seen at the senior leadership level, whole health is continuing to stay a strong focus and is even becoming more strong with the inclusion in the ECF plans for our network and VA leadership. This may be something you haven't seen as frequently, but our current executive in charge and acting undersecretary, Dr. Stone, presented his 10 lanes of efforts to support his 3 priorities, and those 3 priorities are restoring trust, constructing a learning organization, and modernizing systems. And you can see here that whole health is included in that, along with mental health, in delivering 21st century whole health and mental health programs. VA is really transforming our entire healthcare into a whole health system of care. And when we're talking about whole health, you can see here that this is not a program. It's not another siloed approach that we're trying to implement. This is a system approach, a system transformation. It's an approach to healthcare that empowers and equips our veterans to take charge of their health and well-being and live their lives to the fullest. And this is a model of the whole health system of care. And you can see that the components of the pathway, the well-being programs, and the whole health clinical care are represented here. So again, it's really this full system transformation. And if we are successful, if we really implement the whole health model of care, it's going to impact every aspect of how we interact with our veterans at the VA. Personal health planning process is there in the center and really integrates this components. And we're going to begin taking a deeper look into each of these. Much of this, like I said, is going to likely resonate with you as a psychologist, identifying our clients' values. You'll hear us talk about that in terms of their mission, their aspiration, and their purpose. But identifying that mission, aspiration, and purpose and engaging them in active shared goal setting and identifying self-care that can really support this journey, this is something that's likely resonating with you already. So here, let's take a look at the pathway first. And what we have learned through our process in developing this whole health transformation is different people engage in their health and with the health care in many different ways. Some people may want or need to engage fully in clinical care, but others may not. We may, and even if they're not engaging fully in clinical care, they may still be interested in thinking about their health and working on their health goals. Others may want to explore the idea of what their own health and wellness means to them and the things that can impact this. The pathway is a way for our veterans to work with other veterans to start to explore these concepts. As psychologists, we are really aware of the power of peers, with the mental health field really leading the way with peer support specialists. And within the pathway, veterans will work with veteran peers, not necessarily a certified peer support specialist because they already have an identified role established, but they will work with veteran peers to begin doing some of this exploration. In 2018, an executive order was signed that mandated that VA offer mental health services for all separating service members. Many of you are probably aware of that. In addition, or included in this executive order, was mandated that the mechanism identified for doing this be through veteran-led whole health orientation groups. And there are 2 groups related to this executive order currently being offered in the pathway portion. One is the Introduction to Whole Health. And again, this is a peer-led group where the veteran is introduced to the concepts of whole health. And then there's the Taking Charge of My Life and Health group. And this is a lengthier group, can be anywhere from 6 to 9 weeks, where the veteran takes a little bit deeper dive into that exploration of their mission, aspiration, and purpose. And they also have the opportunity to work one-on-one with a veteran peer to begin identifying that map, the mission, aspiration, and purpose, and also the areas of self-care that they may want to begin exploring that may help them to support that. Now, the well-being programs are another major component of the whole health system, and this component includes our skill building. So we have really been working on engaging our veterans through the pathway, and now we want to really empower them. We want to give them the skills and the support that they need. So Things such as mindfulness classes or nutrition classes may be housed here, as well as the complementary and integrative health therapies. And health coaching can be a part of this too, but can be parts of the entire whole health system. Some of these resources may be virtual. Some of them will be on site. And then finally, we have the whole health clinical care. VA is already known for its outstanding clinical care. This is one of the highlights and hallmarks of VA care. And in whole health clinical care, we want to continue that high standard of care. And we want to infuse the whole health principles, which include mapping to the map. So connecting every aspect of our care to what the veteran identifies as really mattering to them, and establishing these shared goals with our veterans that are tied to and supportive of his or her map or mission, aspiration, and purpose. So as we begin this process of transforming to whole health clinical care, note that the empowerment and equipping happen within clinical care as well as through the pathway and well-being programs respectively. And that the personal health planning is the process by which we really connect with the map and develop those shared goals. So this is really beginning to take a look at how healthcare is transforming. So in the past, and again, we're talking about healthcare as a whole, not really mental health care necessarily, but really healthcare as a whole. In the past, it's been what's the matter to you? And where we are currently is what matters to you. We're really beginning to move toward that personalized, proactive, patient-driven care. This is something we've been working on for a long time in VA. We want to take it a little bit further and now tie those goals to what matters to you. How can we help you live the life you want to live? In the past, it's been very provider-driven, shifting more to the whole clinical team, and now we want to take that even further and incorporate the veteran, family, and healthcare team. In the past, we had our case-based paper medical record. We have gone to an electronic medical record that is still focused on disease, injury, and illness, and now we want to move that even more into the future. We want to create and work on a electronic health record that really supports this personalized care that we're talking about. And then finally, we'll address your immediate concerns to now, you have a risky problems, please follow this plan to improve your next visit. So we're really kind of getting that plan in there, but not quite everyone is to this shared goal setting. We want to take that a little bit further and really shift to let's work together to create a plan that fits your life. And here we see the personal health plan. And for those of you who this may be a new presentation for, or your first time hearing about the whole health system, want to make sure that we understand the difference and distinction between a personal health plan and our clinical care plans. The personal health plan is a veteran-owned plan. It is something in which the veteran and all the care providers can enter information and where those shared goals are really housed. So sometimes it's going to feel a little bit different than the clinical care plan many of us are familiar with. And here are some of the key components of a personal health plan that would include the veteran's mission, aspiration, and purpose, goals that she or he has established, the veteran identified strengths and challenges. So they do that work with their health coach or with a peer to really identify what they feel are their strengths, but really coming from a strengths-based approach here. And these are frequently identified, like I said, through a health coaching process. But the personal health plan also incorporates the identification of the skill building and support, and also the professional care to include those shared goals that can be both within the conventional and also within the complementary care, and also includes community resources that support these next steps. So again, this is really identifying at the center of everything what matters to the veteran. And then they build their healthcare team and healthcare goals to support their ability to get there. For those of you who haven't seen this, this is a graphic depiction of the 8 areas of self-care that were included in the personal health plan you just saw. And these are the areas in our life that impact our health and well-being. And part of the pathway and health coaching role is to really sit down with the veteran and help them to explore these areas and help the veteran to identify which areas he or she would like to personally strengthen. In all of our interactions, it's really critical that we incorporate the mission, the aspiration, and the purpose. And we can really do this by simply starting with some questions. And again, as psychologists, this is likely resonating strongly with some practices and the values that we already share. So really asking our veterans, what really matters to you in your life? What do you want your health for? What do you want to be able to be doing in your life? What brings you a sense of joy and happiness? What's your vision for your best possible health? So we've talked a little bit about complementary and integrative health. How does this play in with the whole health system? Well, CIH approaches are resources that are available to, again, further equip our veterans in their pursuit of their health and well-being. CIH can be offered in clinical settings, so in our whole health clinical care, when they are appropriate treatments for a certain specific illness or disease or problem. But they can also be offered outside of clinical settings within our well-being programs and are really intended to be open for everyone and not disease-based or problem-based, but really for well-being and health. So there is the CIH directive. This was signed by the Undersecretary of Health back in May of 2017. So this is active now. And this dictates that complementary and integrative health approaches are now part of the medical benefits package. So in order to provide, because a lot of these CIH approaches do not have the licensing oversight that, for instance, psychology has. So VA wanted to ensure that we are offering safe and effective care. So an advisory board was developed to really evaluate the research and outcomes of various CIH modalities, and there are representatives from a lot of areas from VA on this advisory board, but those include mental health, pain management, primary care, PM&R, population health, geriatrics, nursing service, nutrition and food services, the post-deployment health and risk groups, the HPDP programs, NCP, women's health, and also social work. So a large group of advisory members came together and really evaluated this research, and they came up with 2 lists. List 1 show evidence of promising or potential benefit, and list 2 are generally considered safe. And this shows the list here of the various approaches. Here you see list 1. All of the approaches on list 1 must be provided by VA at every facility. So VA must provide a mechanism to offer these approaches either within the VA facility or in the community if they're recommended by the Veterans Health Care Team. So, and like I said, this is active since May of 2017. So every VA facility right now, as part of the medical benefits package, are required to include or be able to offer these either on-site or through the community. And those include acupuncture, meditation, yoga, tai chi, biofeedback, hypnosis, guided imagery, massage, and chiropractic is listed here. However, it was already part of the medical benefits package. And then list 2, these are not required for inclusion in the VA, but they're optional. So they're generally considered safe and they're approved to be offered at the VA. We've had a lot of questions about this. One specific question is, what if we want to offer something that's not on this list? Well, there's a mechanism to do that. You can submit that CIH approach to the advisory board. They will review the evidence and then either put it on list 1 or list 2. But at this point, if it's not on list 1 or list 2, it really should not be being offered at the VA because it's not been an approved CIH modality. So how do psychologists play into whole health? I'm hoping this is really sounding very familiar to you, feeling like, yes, we've been doing this. I came from like Tiffany was saying, I spent a lot of my career at the VA working in the PCT clinic and with our military sexual trauma program. And so a lot of work in PTSD. And I incorporated this into my practice. I did a lot of acceptance and commitment therapy and the DBT, but identifying the values and then helping our veterans to live a meaningful life was something that resonated strongly with me. And so this move and this transformation across the VA was something that just really pulled for me as a psychologist. And we see here why. Facilitating and supporting behavior change, that's what we know. That is our role as psychologists. We are change experts. We are experts in enhancing motivation and really focusing on activating our clients and engaging them in their care. We have extensive history in providing patient-centered care and our training and our collective values. This is part of who we are as psychologists. This philosophy of values-driven care is something that has been a cornerstone of what psychology is, and attending to the whole person. We have years of experience with cultural transformation, and we're seeing that with mental health really leading the way in this recovery model. This has been a transformation that mental health and psychology have been involved in for a while now, including systems thinking and integrated care, and then also leadership roles. And in each of these areas, we are seeing psychologists really play a part at the local, VISA, and national levels, and really helping to support this cultural and system transformation across VA. We're seeing it through program management roles, through our PCMHI roles. We're seeing it with recovery model. Nationally, we have psychologists involved in the whole health transformation. So lots of opportunities for psychologists because of who we are and our collective values to really be involved in this and to help lead this transformation. And the whole health approach is so aligned with our core values and as a profession, and really with the recovery model that we have been following in mental health as a whole. Excuse me, I've got a bit of a cough. So we've been discussing what a whole health system of care incorporates. I want to shift now to how we are implementing whole health across the nation, and then review some preliminary outcomes that we're already beginning to see. And this map shows our 18 flagship facilities. There are 18 facilities, one per VISN, that are currently in a 3-year process. These were kicked off in 2018, so FY18. So we are currently in year 2, just started year 2 of this. And this was an initiative that was in response, first of all, to some positive outcomes that we were seeing from adopting whole health approaches at our design sites and other sites around the country, but also to the Comprehensive Addiction and Recovery Act. The CARE legislation requires VA to establish pilot sites to evaluate the effectiveness of CIH specifically in patients with chronic pain and substance abuse history. So our flagship facilities, instead of the CARE legislation really only required 15 pilots through VA. But our network sponsors came together at a meeting and they made a decision. Let's roll this out and support the care legislation through whole health transformation. And instead of limiting it to 15, let's have one per network, one per VISN. So our flagship facilities have really taken the learning that has occurred over the past several years at our design sites and at facilities who've been piloting various aspects of whole health transformation, and are focused on a 3-year implementation of the full whole health system. So at the end of that 3 years, they will have all components of that whole health model in place. And they're also participating in a large-scale evaluation, and we are examining clinical outcomes, we're looking at costing, and we're also looking at the impact on these particular populations that we just spoke of with the chronic pain, substance abuse, mental health. And these are the hypotheses that we have made regarding whole health based on the results of whole health implementation today. So the first hypothesis is that empowered veterans focused on well-being with ownership of their health will be happier and healthier individuals. We'll see improved health outcomes, improved patient-reported outcomes, decreased prescription drug use, opioids, improved healthcare experience and satisfaction, and decreased healthcare cost. And as a corollary to that, we expect healthcare optimization. So less burden primary and specialty care, easier connection with our patients, decreased provider burnout, and improved employee well-being. So what are we seeing so far? And again, we've been looking at this over a couple of fiscal years. So we are looking at a whole health cohort versus the rest of the population. So to orient you here to this graph, the blue line is the whole health cohort. And what we are counting as the whole health cohort are veterans who have had at least 2 whole health encounters or visits. The red line is the remainder, the VA population at large. And I do want to point out that this is trending data, so that this is looking at our whole health cohort over time. And it's not necessarily the same group of people in FY17 and FY18. So really just looking at trends here to see what we're beginning to have signals about. And what this graph specifically is showing is that veterans who are using whole health tend to have higher engagement in behavioral health activities than the rest of the veteran population. And this is really aligned with our intention around whole health to get veterans more engaged in their health and in behavior change. So in addition to this, given the whole health emphasis on the addiction and suicide prevention, this is really a result we hoped for. We wanted to see more engagement in behavioral health in this population. And another thing to know about the cohort in particular, and I don't have this graph in here just for time's sake, but just to point it out, you might think that whole health is really targeting or attractive to our veterans who are healthier. What we're actually seeing is that a lot of, in fact, primarily the veterans who are attracted to whole health are very complex veterans. So this is data from not just our well veterans, but really more so from our very complex with multiple comorbidities, high cost. Those engaged, these graphs are showing that those who have been engaged in whole health have also had more engagement with other services aimed at behavioral change. For example, increases in weight management and nutrition visits we're seeing. What's really nice to see here, though, is that even with these more complex veteran population, there's virtually no change seen in their primary care visits. So this has been a concern as we begin making this transformation, and some of the resistance and fear and really realistic resistance, because our providers are very taxed in terms of time and access. But what this is showing is that while we're seeing an increase in some of these behavioral change visits, we're not seeing an increased burden on the clinical care. So increased engagement in behavioral change areas, but not on the primary care. So that is very exciting to see. And again, this is trending data, but it's consistent with the projections and the hypotheses that we had. And we really have to look at this as a signal that we're heading in the right direction. Our assumptions feel like they're correct based on the initial data that we're seeing. And we're also seeing some initial outcomes with result to the cost in the pharmacy cube. So those who are engaging in whole health are beginning to trend to have a lower cost within the pharmacy cube. And again, that's some initial signaling of cost savings. We're not expecting to see any return of investment really until after that third year. But we're beginning to see this trend, which is great to see. And you can also see trending a decrease in the national opioid use and cost in the whole health cohort, while the rest of the VA population is still having a rise in that. So trends are all looking very good so far. However, these are signals that we're headed in the right direction, but we really can't address causality with that. So what are we doing to evaluate health outcomes? Well, our flagship facilities are doing a concerted effort to review patient-reported outcomes, clinical outcomes, and we will have data on this in the coming years. Like I said, we're just beginning year 2. We do have some initial data beginning to come out of this, but as it relates as whole health, the main questions that we are looking at is how do patient health and well-being outcomes improve when whole health is implemented as intended. So if we're really implementing a whole health system according to the model, how does that really impact the health outcomes? And does full implementation of whole health in response to CARA's mandate that VHA implement these CIH approaches and alternative approaches to pain management really lead to meaningful improvements in those pain outcomes? And then how does whole health impact other patient outcomes like engagement, activation, communication, BMI, hypertension? And you can see the specific measures we're using over here on the right for those. Currently, our research team has identified about 887,000 unique veterans who had primary care mental health outpatient visits in the last year, and those with chronic musculoskeletal conditions with moderate to severe pain across our flagship sites. And they are surveying these veterans at baseline, 6 months, and 12 months with a future goal of having about 10,500 baseline surveys completed and then 6,300 completed at the 6-month survey. And we've just begun administering the 6-month follow-up survey. So again, very early on in this process, but this is what we will have some specific data surrounding at the end of the flagship. So we're looking at causality, we're looking at health outcomes, we're looking at cost, we're looking at the impact this has on access and time around our system. But what do we know about what our veterans want? Is this something they want? Is this something that they're engaging in? And this chart really highlights an initial flagship study survey that has gone out to our veterans. You can see the target was 10,000, and the results of this are based on an analysis of almost 1,400, 1,395 return surveys. 97% responded that they were either somewhat interested or very interested or already using at least one whole health service listed. So this is something our veterans want, and we know from the Hague report that many of our veterans are already using various aspects of whole health in their life outside of VA. So it's good for veterans. We're seeing the initial trends heading in the right direction, and VAs want it, our veterans want it. And this survey, this is the same survey that went out from the previous slide, But this is just highlighting that one thing that most veterans are interested in is a clinician that asks, what matters to you? That really incorporates that mission, aspiration, and purpose into the clinical care visits. So our veterans want it. We're seeing some initial good trending here. What about our employees? How is this going to impact VA employees? We know that burnout is an issue that we as psychologists face. Our clinical care team members are facing burnout. How do we address that joy in work that we saw back on the IHI rules? So from the all-employee survey, what we have seen over this past year, AES, is that employees who are engaged in at least one whole health activity within their work are showing higher scores, specifically on leaders lead, supervisors, intrinsic motivation, and best places to work. So again, some positive outcomes beginning to show for how our employees who are engaging in whole health are reacting to this. And anecdotally, we do know from our, this is some specific data that we're seeing from AES and SAIL. Anecdotally, we have heard across the nation that this is why we went into healthcare. This is why we are here. We want to really have a difference with our veterans. We want to help them have meaningful lives. So we're hearing that our practitioners, our clinicians, all of us are really tapping back into why we went into this in the first place. And again, this is our SAIL, and sites that have more employees who are engaged in one whole health activity are showing higher scores on the SAIL ratings. Again, we're all psychologists. Can't really address causality here. It's just some trends we're seeing. So I've talked really fast. I've given you a lot of information here. But in summary, in VA, we are on a really exciting journey of transformation. This is probably one that is going to sound very familiar to you on the call. Our veterans in this whole health transformation are full partners in their healing journey. Our veterans identify their direction in life based on what truly matters to them. And we build their care in partnership to support that mission, aspiration, and purpose. And most importantly, our veterans are known for who they are and not what pain or suffering they carry. So I appreciate the time today. I hope I didn't present too much information too quickly. I know sometimes it can be a lot of data, but I want to just pause now and open up, see if anybody has any questions or comments.
Dr. Hedrick, I think maybe people have questions. If you do have questions, feel free to enter them into the chat box. I know that there's a variety of participants today on the webinar. Some people who work in the VA or outside of the VA. Some of us are more or less involved with whole health at our local facilities. I know there are a fair amount of health promotion, disease prevention folks on this webinar too, so a wide range. Yeah.
That's great. Yeah. Really, this is, when we talk about this transformation, this is building on, not in replacement of all of that work. It's really including all of the work, MI and TEACH and all of the work with HPDP and our health behavior coordinators. And it's really important that we look at how we build on and begin to include all of those things into this transformation, because it's not an exclusion of, but really a model to begin helping this spread and to tie it to for the VA. The work's been done, the work's there, we want to build on it now and provide a model and an approach to care that all of the entire VA system can begin enacting that and moving towards. So, yeah, and I For those of you who are not in VA, some of these terms, the cell rating that may be, it's one of our measures. But so if you do have any questions, I'm happy to answer them, or if you want to reach out afterwards, whatever's easiest.
I'm not seeing any questions pop into the chat box. Oh, maybe there are a couple coming. There's a comment from Dr. Pink. Excellent presentation. Looks like there's a question from Sharon. Are there plans to implement this model in sites that are not flagship sites or design sites?
That's an excellent question, Sharon. And actually, this model in some fashion or form is being addressed at almost every VA facility we have. The formal rollout of this transformation with our flagship sites was, we call them flagships because they were our first wave of sites, and we're tied to the CARA legislation, so there's some research and things that we're doing with that. But we're about to begin our second learning collaborative with sites, where we will begin working with 2 additional sites within each VISN to begin expanding that work that's happening at the flagship facilities. So each of you at the VA facilities have a point of contact at your VA facility who's working on whole health. And we have, through the Office of Patient-Centered Care, field implementation team consultants who work with every site around the country to begin promoting and implementing whole health. Our sites are at various stages, depending on a number of factors. But if you are interested in finding out about what's happening at your facility, don't know who your point of contact is, if you want to just reach out to me, my email is on the first slide. You can get it back up here. But I can get you in touch with your field implementation consultant who can let you know what's happening currently at your facility and put you in contact with the folks there at the facility. So yes, we have a lot of work happening across the country already. Formally, we have the flagship sites and we have our design sites. And our design sites are sites that the Office of Patient-Centered Care has funded prior to the flagship facilities to kind of help us learn about whole health and the models that work. And we're continuing to work with them. So we have our design sites, we have the flagship sites, and then now we have the next 2 sites that we'll be bringing into a formal learning collaborative. So happy to put you in touch with those, but that's kind of how this rollout is happening. And yes, there are plans to continue implementing this, and this is a transformation the entire VA is making. So.
And there's another question from Kathy O'Donnell. Can you explain how List 2 approaches will be utilized? Given that we are an evidence-based culture, what is the evidence base for things like aromatherapy, healing touch, EFT, etc.?
Another great question. So when we looked at that List 1 and List 2, the List 1 are the ones that had the evidence supporting those are the evidence-based and also considered safe. List 2 does not mean that they don't have any evidence. There was just not the strength or quantity of the evidence for those, but they're generally considered safe. So those would primarily be in terms of well-being. They're optional to be provided, but they're not required. So it's just how they're going to be implemented is going to be based on the site and the decisions that the site locally makes versus something that's required of every VA, if that addresses the question. So that would be more of a local decision on how those are rolled out or included.
I'm not seeing any typing in the chat box, so I'm not sure if there are any other questions coming our way. Dr. Hedrick, thank you. Yeah.
And I do want to acknowledge Dr. Jennifer Patterson. She's not able to be here today, but she is a senior consultant for our office, and this was a presentation that she and I worked on collaboratively, and she's also available for questions as well. So you can reach out to either one of us. I was going to add
to Dr. Hedrick, I know that we're also, for people who are attending the VA Psychology Leadership Conference this coming May, I think we'll also have another presentation on whole health, so that's exciting. And Dr. Patterson will, I think, be presenting. Will you be presenting to Dr. Hedrick?
That is great.
Okay. We can look forward to hearing more about whole health at the conference.
I'm not positive.
And I put the first slide back up, so if people want your email address, they have it right there on the slide. I guess we can start wrapping up. So thank you again, Dr. Hedrick, and thanks to everybody for being on the webinar today. And for those of you who are interested in receiving continuing education credit for participating in today's webinar, you're welcome to do so by requesting or by completing the online evaluation. You'll see a link in the notes pod, but I'm going to also copy the SurveyMonkey link into the chat box to make it easier for you. So of course, continuing education credit is free for Division 18 members. It's also available to non-members for a fee of $15 that can be paid through the PayPal link, which is also, there's a link to the PayPal and notes in the notes pod. And then I'll email continuing education certificates to everyone who expressed interest in about 2 to 3 weeks. And I'll also send a reminder email following today's webinar just to remind you guys of all of these steps and instructions. And before we go, I want to give a quick plug for next month's webinar on May 2nd. It's titled First Episode Psychosis Interventions in VA, presented by Drs. Amy Wilson, Shirley Glenn, Rachel Calixt, and Emily Gagan. And a flyer for this webinar is available in the files pod for download, and you can register if you wish by clicking on the registration link on the flyer. And for any other follow-up questions, feel free to contact me. Thank you again, everybody. Thanks again, Dr. Hedrick.
Thank you so much for having me.